did you say a family of four making $60-some thousand? What was the figure you used? So they will qualify under normal Obamacare subsidies, probably about a 7%. So they'll have to pay 7% of their income before they get a subsidy. What he said is just completely wrong, completely false. And
well, $1,450 to $4,570
per month. Family of four. Family of four.
Family
Again,
of four.
I was buying health care prior to
can say
Obamacare.
all
It's not
you want,
not
but
even
the
close to what
family,
premiums were back then.
The family knows
So
what is happening.
Hey, Mr. Ranking Member, just real quick, did you say a family of four making $60-some thousand? What was the figure you used?
A family of four earning $66,000 will see their costs triple.
Okay, so again, I've just got to point out things that are completely incorrect. A family of four making $66,000 is between 200 and 225% of the poverty line. So they will qualify under normal Obamacare subsidies, probably about a 7%. So they'll have to pay 7% of their income before they get a subsidy. Under the enhanced premium, they had to pay about 3%. But again, that was a temporary COVID subsidy, so they're not losing their subsidies. It's just going from above 3% of their income to now they're going to have to pay 7% of their income for health care. So under no scenario, you can't do math where that family is going to have double or tripling of premiums. This just doesn't happen unless the overall gross premium is doubling and tripling, and nationally it's going about 26%. So again, I'll ask the ranking member in questions for the record to give me the detail on that, but I just have to point out to the people watching this, what he said is just completely wrong, completely false, and
Well, I
we
beg to differ,
just need
Mr.
to point that out.
Unfortunately, I wish I were wrong.
You're not, so
And,
provided we'll put it in the record, and I'm happy to.
I will be happy to put it in the record. These numbers come from the Center on Budget and Policy Priorities. The current payment of that family is $1,450, and it will rise to $4,570 a month without the subsidy. $1,450 to $4,570
Per month. Family of four. Family of four.
Family
Again,
of four.
I was buying health care
So you
prior to
can say
Obamacare.
all
It's
you want,
not even
but the
close to what
family,
premiums were back then.
the family knows
So
what is happening.
again, I'll try and get
I'm
this
sorry,
detail.
that is per year.
We'll try and get this squared away. Pursuant to,
Just make sure we noted the correction. So is that a dollar amount per year or per month?
Per year.
Because that does make a big, that 12
Yeah,
times difference.
I'm sorry, I misspoke when I said per month. It's per year.
okay, pursuant to Rules 8C of the Rules of Procedure of the Committee of Homeland Security and Governmental Affairs, the ranking member and I approve of Senator Slotkin participating in today's hearing. It is the tradition of this committee to swear in witnesses, so if you all rise, raise your hand. Do you swear the testimony you give before the subcommittee will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Our first witness is Mr. Christopher Briggs. He is the Publications and Public Affairs Counsel at the Independent Institute. He received his Bachelor's of Arts in History and English from Bowdoin College and holds a Master of Arts in Political Theory from Catholic University. Mr. Briggs.
Chairman Johnson and Ranking Member Blumenthal and members of the U.S. Permanent Subcommittee on Investigations, please allow me to thank you for the opportunity to testify before you today about the harm Obamacare inflicts on the American people. And I just have to say, this is the first time I've had a chance to sit in front of the Senate. If no harm has ever come to anybody under Obamacare, and it's such a great plan, why are you all not on it? In November 2015, my wife got the most dreadful call a parent can get. The doctor knew why our youngest daughter, Colette, hadn't been feeling well. Blood work had revealed leukemia. So we raced Colette to Inova Fairfax Hospital, the only one in Northern Virginia that treats pediatric cancer, and got there just in time. Now, thanks to Obamacare, we were already in difficult straits regarding health care. Before the ACA went into effect, the market had offered us a wide variety of relatively inexpensive plans that covered specialist care, even out of state. After the ACA, however, all that was left were increasingly costly plans with fewer benefits, including fewer doctors and fewer hospitals. Thanks to the ACA, we were basically restricted to the medical facilities within a short distance of our zip code. The healthcare experts among us will talk about narrow networks. That doesn't even begin to describe the horror. Obamacare made us into medical serfs. We are tied to the land, unable to leave it, even to save a little girl battling cancer, which is why when we tried to take our daughter Colette to Johns Hopkins up the road in Baltimore, we were denied. Under our pre-ACA plan, which didn't geofence sick children from the care that they deserve, she would have been admitted. Now, our predicament was made even more painful by swelling premiums and skyrocketing deductible and maximum out-of-pocket expenses. Pre-ACA, our monthly premiums were about $800 per month, and the maximum back-end expenses was about $3,500, give or take. After the ACA went into effect, our monthly premiums, and this is with subsidies, went to nearly $2,000 per month. Annual deductible and maximum out-of-pocket expenses with subsidies, $20,000 a month, or nearly. And thanks to cancer, which my daughter came down with, we hit those maximums many, many times. So think about that. In the 10 years since the Democrats inflicted Obama's health care plan on us, we had to pay for many, many years, almost $50,000 annually in insurance payments and medical bills. And that was money we did not have. No middle-class family can endure that kind of expense. The upshot of our decade of affordable health care under Obamacare, our savings are gone. And we have virtually nothing left to retire on. And to handle the remaining debt, we are beginning the process of taking out a home equity loan. And this is the subsidized affordability that the Democrats today insist Congress perpetuate. Now, in those dark early days of cancer, when my daughter was first diagnosed, things got much worse than expensive. In 2018, Obamacare literally offered us no plan in our zip code for any amount of money that we could buy that covered Colette's treatment at the one pediatric cancer ward in Northern Virginia, in Nova Fairfax. So under Obamacare in 2018, our daughter was effectively without coverage for cancer, not a common cold or a broken bone, but cancer. What kind of health care plan did the Democrats inflict on us that it can't handle childhood cancer? And we went through another terrifying event in 2020. Now, with COVID sweeping the country in mid-March, the plan we had that year announced that in 2 weeks, it would no longer cover my daughter's clinic, where she received a lot of her chemotherapy. So once again, thanks to the ACA, we were left without coverage for our daughter recovering from cancer. Now, in both cases, we had to appeal to the author of our problems, to the government, to all of you. And fortunately, I was able to persuade, threaten the Senator Warner's staff to bully, in both cases, an insurance giant back into the marketplace.